So other systems involved in systemic scleroderma will be GI. So GI tract is involved in 25% of the patients. So involvement of the viscera, esophageal and intestinal visceral involvement will cause dysmotility. So patients will have dysphagia, malabsorption and resulting in failure to thrive. So reflux, dysphagia, gastroparesis, bacterial overgrowth is common. Next involvement system will be renal arterial involvement leading to hypertension, cardiac involvement, valvular or arrhythmias or ventricular hypertrophy is also common. So talking about Raynaud phenomenon. So children and adults with systemic scleroderma can have Raynaud's phenomenon. So what exactly is this Raynaud phenomenon? So this is one of the initial symptom in a pediatric systemic scleroderma. So what happens in Raynaud phenomenon? So number 1, look at this image. So step number 1 is fingers will become white because of lack of blood flow, and then they become blue as the blood vessels dilate to keep the blood in the tissues. From white it turns into blue, and then as the blood flow returns, finally the fingers turn red. This is Raynaud's phenomenon. So Raynaud's phenomenon can be reproduced in our clinic by immersing the hand of the affected patient in iced water and by warming. So the Raynaud phenomenon is seen in systemic scleroderma. It's also seen in SLE and mixed connective tissue disorder. So Raynaud phenomenon not only affects the distal fingers, it can affect the ears, nose tips, toes also. Affected area is well demarcated and becomes uniformly white. The patients will have a tingling sensation and pain paresthesias during the Raynaud phenomenon. Chronically, if the patient is experiencing episodes of RP, digital ulcers are also possible. There is another entity called Raynaud disease. So Raynaud disease is a disease of adolescent age group. What happens in a Raynaud disease? Typical phenomenon, Raynaud phenomenon appears, but there is no systemic features, just the Raynaud phenomenon. Symmetric occurrence, only the changes of color from white to blue, and then rewarming it will become red. There is no tissue necrosis or gangrene. So this is Raynaud disease beginning in adolescence.